Thanks for joining, everybody. Now, during today's session, we will explore how engagement with local governments has evolved during the COVID-19 pandemic, as we are all aware, the kind of adaptations employed during this pandemic, and we want to showcase this through 3 case studies. There'll be 2 from Malawi and 1 from Kenya. All the 3 are from BHA development partners. We also want to get some learning outcomes from these adaptations and how this learning is informing future programming for these BHA partners and the people that they work with. Before we get started, let's take a few minutes to get everyone engaged and understand our involvement in the topic today. My colleague Meredith is putting a link to a Mentimeter poll in the Zoom chat. Please go to that now. So just check in the Zoom chat. Meredith will be posting a link for a Mentimeter. Please go to that now. You'll find some interesting questions for you. It can take about 5 minutes on the Mentimeter. For those who are just joining, please welcome. Meredith, you can post that link, the Mentimeter link again, for those who are just joining right now. Thank you. Give us just another 3 minutes to wrap up on the Mentimeter. The questions are in the Mentimeter. We are now looking at how much has the organization worked with local governments. We got 2 more minutes to wrap this up. How have you seen involvement with local governments decrease, increase, or stay the same during COVID-19? Have you seen involvement with local governments decrease, increase, or stay the same? during COVID-19 within your context of operation. And in our next sessions, we'll be looking at 3 case studies that illustrate how this involvement has evolved for Kenya and Malawi BHA partners. Right, we got a minute to wrap the Mentimeter. Or assuming we are as good as done, I will set us into the next session. So let me introduce our presenters for the next session. Like I said, we have 3 case studies, 2 from Malawi and 1 from Kenya. Our Malawi case study will be presented by 2 gentlemen. We have Mr. Ken and we have Tom. Now, they will be talking. So Ken Somanje is from Malawi's Titukulane activity, and he is the governance and accountability lead. While Tom is Titukulane's activities governance resilience coordinator. We will have a case study from Edwin Mbaya, who is with Kenya's Nawiri, which is another BHA activity. So Edwin Mbaya is Kenya's Nawiri system strengthening and institutional lead. The 3 gentlemen will be taking us through 3 case studies of their involvement with local governments during the pandemic, and how this has evolved, and potentially how this is shaping their future programming. So we will let the Malawi folks begin first. They'll give us a quick introduction of the activities, and then they will take us through the case studies. The first case study, which is from Malawi, is an initial entry to working in partnership with local governments during COVID-19. It will demonstrate how Titukulane understood governments and protocol relationships between local and national government while building agency, decision-making, and policy mandates. And our second case study from Malawi, which will demonstrate how Titukulane worked with the local governments to respond to COVID-19 and how it tested Titukulane's working relationship with local government. We have the one from Kenya, which will also demonstrate in a different context how Nawiri leveraged partnerships and relationships with local governments to respond to COVID-19 through the BHA activity. So I will let at this point, I will let Ken and Tom take on their presentations. Meredith.
Good morning. Yeah, good morning, good afternoon. I'm sharing my video for a few seconds for those who just joined to be able to see me. But like I said, I'll switch it off so that I reserve the bandwidth for my audio so that I can be audio enough. So thank you. I will be starting with the introduction for Titukulane. So maybe before I proceed, let me just check if you can hear me.
Yes, you're audible.
Okay, great. So a bit of a background for Titukulane. Titukulane is an activity that is funded by USAID to the tune of $75 million US. It's a resilience food security activity started in 2019, and it is going to end in 2024. So basically, Titukulane supports the implementation of the National Resilience Strategy, which is basically government's blueprint for breaking the cycle of food insecurity in Malawi. And my colleague, who is the next speaker, is going to talk a little bit more about the National Resilience Strategy. So we just wanted to share a bit of our experiences and some lessons and practices with working with local government within the COVID-19 pandemic environment, specifically on the initial entry to working in partnership with government. So one of the first things that happened, especially at the district entry, is that Titukulane made the entry through technical subcommittees at the district level. Let me also mention that COVID-19 presented some sort of opportunity for Titukulane to engage and work with local government at the district level, because the pandemic emerged in Africa at exactly around the same time that Titukulane was about to start making formal entry into the two districts. Let me also add that Titukulane is working in two districts, which are Zomba and Mangwechi, and it is a consortium that has partners, like I said, USAID as a donor, CARE as the consortium lead. We have Save the Children implementing one of the implementing districts, and Emmanuel International in the other district. We also have National Smallholder Association of Malawi, but also IFPRI and Water Aid. So I'll start discussing the case study one, which is the initial entry to working with partnership in a COVID-19 setup. So I was just talking about the district entry through technical subcommittees, which sort of laid the base or the right foundation for collaboration by making sure that all the technical subcommittees are on board before we interface the larger executive committee at the district level, which is a mandate when a new program is entering the district. So Titukulane also opened up as a player ready to meaningfully collaborate and coordinate with government and other stakeholders to implement the district response and recovery agenda, which included COVID-19. So the other thing was that Titukulane's response or engagement was demand-driven to the district COVID-19 response and preparedness plan, where Titukulane worked with the local government. By local government, we mean district government at the district level. Our engagement was guided by national and district preparedness and response plans that outlined the key priority areas on preparedness, but also response to the COVID-19 pandemic. And then the other thing was mapping and tracking of supporting partners, and also looking into resource gaps, where Titukulane worked with government to map stakeholders who would support aligning potential collaborators to the response plans, but also the actions that followed. We were also engaged in joint activity planning, where the project worked with different technical working groups at the local or district level, for example, health, district civil protection, and others to support activity planning and also implementation. Last but not least, Titukulane also engaged in implementation through district government with Titukulane resources. So the project was able to commit some resources with the donors' approval to support the implementation of the different activities as laid out in the plan to respond to the pandemic. So basically, Titukulane responded to the local government's call for support. After the national response plan was downscaled to districts, there was a call for support from local government, and Titukulane contributed towards addressing resource constraints in government to fight the pandemic. And some of the things that were involved included community outreach, provision of NFIs, especially around WASH, but also coordination support. And lastly, Titukulane also facilitated vertical coordination, including alignment with the national plan. And just to add, the project had an active presence in different clusters that were activated at the national level to support with the COVID-19 response. So Titukulane was engaged in escalation of issues on preparedness, but also issues around response to the different clusters at national level. Basically supporting the coordination between what is happening at the national level and the district level. Thank you so much, and over.
Thanks, Ken. Just to give people an assurance that I'm not a bot, just a sneak peek, and then I'll take off the video just to save bandwidth from this side as well. So how did we work, or how did we make it work with the local governments? The first thing, reinforcing what Ken said, is that we planned together. Upon declaration of COVID-19 as a disaster, the government activated the thematic disaster response clusters at both national and the local government level. And these included health, WASH, risk communication, community engagement, protection, food security clusters, and others. These were responsible for drafting the different components of the COVID-19 preparedness and response plan. And as Titukulane staff, we joined the national level clusters and actively supported the formation and operationalization of the district clusters. Titukulane was engaged in the formulation of the national and district level blueprints. So even though we're using a different planning infrastructure, we're using the disaster clusters rather than the usual bilateral discussions at sector level with respect to planning for activities, we were actually targeting the same impact areas. It was still health, social behavior change, food security that we're trying to impact. The second thing that we did was to let the local government lead. So once the plans were approved, Titukulane staff and local government staff and other development actors, we jointly planned for the specific activities, identified the resources, and then proceeded to implement. The local government staff led in the implementation. And why? Well, they were familiar to the communities. At the initial stages of COVID-19, I think there was a lot of distrust. There was a clear understanding at the community level that COVID was, at least in the Malawian context, an urban disease, an elite disease, something that came with strangers. And this is not a tag that the local government staff had. And secondly, they also had lower thresholds of institutional preventive measures. So they were not restricted to working from home. They had a shift rotation system. So half the office would be working this week and then the other half the next week. So they kept the operation running. They were not subject to travel approvals on a case-by-case basis, as was the case for a lot of international NGOs operating in the initial stages. And for example, their vehicle capacity was only reduced according to the government regulations, which was 60% of vehicle capacity, whereas for a lot of international NGOs, the practice at the initial stages was 1 passenger per vehicle. So it gave them greater mobility, and then they also had access to the participants. And the third way of working was we were flexible with resources. So knowledge about COVID-19, the risk factors, the modeling around potential impacts changed rapidly, as did the response plans. The initial national and district blueprints were developed in 3-month cycles, and this changed as more was known about the disease. Flexibility in allocating resources was necessary to address evolving needs. In the case of Titukulane, resources were released earlier than planned. So even though we were in what was the refine and implement period, the donor accepted that we could start in order to address the need that was emerging as a result of COVID-19. And we were also using local government delivery channels other than own staff. I think it was a time when Titukulane was still either recruiting or onboarding staff. And then as an example from the content for the social behavior change interventions, I think these were pivoted from food system strengthening, nutrition, sexual reproductive health, and other topics that are typical for resilient food security activity, so that they were now focusing on COVID-19 awareness. So the 3 Ws: wash your hands, watch your distance, wear a mask, and also prevention in terms of purchase and distribution of PPEs. I think these changes were easier to propose and get approved, both from the donor perspective, but also with respect to the local government executive, in the COVID-19 situation compared to the typical programming scenario. So working successfully in local governments, working successfully in local governments to respond to pandemics, we take away three things. One, participate in the planning. So get involved from the beginning. Two, let the local government lead. They have better access to communities, they have greater mobility, they're already there. And the third part is be flexible with resources. So timing, the channels of delivery, the content, so that they are responsive to the emerging needs and knowledge of the disease. And this is how we worked. Thank you. Back to you, James.
Thanks, Titukulane. Next, we have the case of Kenya, Nawiri, Edwin Mbaya.
Thank you, James. Hi, everyone. Glad to be here and to join you in these discussions. Very interesting to listen to the Malawi experience, pretty similar to what we did in Kenya. And the good thing is that I won't focus on the whole of joint planning aspects because they were very similar to what we did, but maybe just our experience of how that worked. So work for the Nawiri program, whose main goal is to sustainably reduce persistent acute malnutrition in two local governments or county governments, because in Kenya we have a reverse system of government. So it's a 5-year program which started in October 2019. So we are heading towards the end of the second year. And the program is slightly unique in terms of its design, whereby it has two phases, where the first phase is focusing on evidence gaps analysis, whereby we focus on trying to ascertain some of the evidence gaps that are there in addressing the problem of persistent acute malnutrition. And then the second phase of the program is using the evidence to design program and scale them up for the next 3 years. So very quickly, in terms of the approach of how the Nawiri program is designed, it has a very key component of engaging government, and specifically for good reasons. To attain sustainability, government needs to have the requisite capacity to make the right sort of investments to ensure that the problem of persistent acute malnutrition is able to be addressed in a sustainable manner. Broad participation of various stakeholders, key among them communities and citizens, but also, as I mentioned, on our research and learning agenda, a specific focus on synthesizing available evidence, knowledge, and experience to inform programming. Next slide. So similar to the Malawi experience, so Nawiri also really deeply engaged government in joint planning for our COVID response, and just to make sure that also some of those response and interventions were government-led. However, the pandemic hit our country in March last year, when we're just in the process of co-creating together with government our research and learning agenda for phase 1. But even as that continued, we were forced actually to very quickly sit down with the government and design a COVID response plan that focused on 4 main areas. One was the functionality of community health systems, enabling hand hygiene through hand washing, supporting functionality of market systems, and really coordination of the information that was being shared. And from our experience engaging government through all that particular process, we realized that coordination was a real challenge from the local government perspective. Why? Because we had a good number of participants, good numbers of stakeholder and organization, NGOs, CSOs, who had received funding and were willing to support government, but then government was not really able to very quickly sort of coordinate all of them so as to make sure that there is no duplication of effort. So at the beginning, we realized lots of duplication of efforts because of government's inability to coordinate all the actors that were willing to engage them. Then COVID introduced, of course, the virtual working environment. Now, mostly, I don't know in other contexts, but here, virtual engagement is not really considered as official way of government transacting business. So really we faced for the last 1 month or two, quite a bit of challenge in terms of bringing government officials on board and continue engaging them through the various virtual platforms. So there was very slow uptake of engaging with government virtually. Most of them had challenges as far as technical know-how of using some of these applications were concerned. The counties we work in are really far-flung with network connectivity challenges, physical infrastructure challenges. So, connectivity was quite a sort of an issue. So part of our support was providing them with virtual conferencing equipment just to facilitate ongoing interaction with them. Lastly, on the experience is that one of the things that we realized, which was very, very interesting, is how government was very willing to and receptive to ideas where sort of they worked. So one of our components was really to disseminate COVID-related messaging to communities, but then that was happening. But what was lacking was government didn't have any mechanism of ensuring that they're receiving feedback from citizens or communities in terms of how they were being affected by the pandemic. So we engaged some youth using their social media platform to disseminate some of this information and get feedback from citizens. So that's the feedback that we organized and shared back with government. And it was very interesting that how quickly government was able to uptake this feedback and use the same forums, that is social media forums, to again respond and engage the youth, something that they were facing various challenges initially at the beginning of that particular support, which was very, very quite interesting. And we really had a periodic learning sprints to review our interventions, what was working, what was not, and making the necessary adaptations. Last slide. So just two main key lessons on the next slide. Number one is coordination support of government is critical at all times, and more so when a pandemic sort of hits. So maybe just a lesson to share to colleagues who are interacting with government to make sure that regardless of what we are doing, to make sure that the coordination of capacity of government is always maintained, and because whenever a pandemic hits, then it really exposes government in bad light. Second lesson that we learned is that despite the rigid system that government have, local government, national government, there's always willingness for them to learn and adapt accordingly whenever you provide them evidence that really calls them to action. Thank you so much.
All right. Welcome back, everyone. I'm sure you had some interesting discussions. Interestingly, these things, they always need more time. It gets better as you keep talking. But I hope you are all able to pick up a volunteer to present on behalf of your group. We are going to have reports from each of the breakouts. We'll have about 3 to 5 minutes brief. Let's keep it as brief as possible. Meredith will share the screen if it's possible. So we'll hear from each group on common challenges, opportunities, and general thoughts out of your breakout. So let's start with group one that I was facilitating, and we will have Andrew pitch on our behalf.
Okay, great. Hello, everybody. My name is Andrew. I was in group one, and I'll touch on a few of the highlights. So for the first question, which is around if we've seen the role of local governments evolve over the course of the pandemic, we've seen that local governments' response to issues have changed. How willing they are to collaborate with partners at the district level has changed for the better. And guidelines for direct investments, such as allocations for certain sectors like health, has improved. And there was, as an example of that, rapid establishment of new health centers directly linked to the pandemic. For question number two, how could we strengthen partnerships with local governments to effectively navigate the ongoing and future pandemics? We talked about the possibility of having joint emergency response plans for pandemics that are formalized in writing, and working through community platforms and groups that serve administrative districts and government platforms to organize and coordinate stakeholders to formalize partnerships. So kind of working across sectors, top to bottom. And then for the third question, which was around risks and opportunities of partnerships, we thought maybe there was an opportunity around capacity building in healthcare space and also in other government sectors, that there is a risk around quality control, walking the line between capacity building and making sure that everything is uniform and is of best quality. And another great opportunity, which I think is big for all of us, is working with the government at a higher pace as opposed to slower traditional engagement, and seeing big obligations from the national level of pandemic response, and kind of exposing the potential of what the government is capable of doing. So that's Group 1's report out, and thank you very much. I'll turn it back over to you, James.
Thanks, Andrew, for that. Next is Group 2.
Okay, from Group 2, we have Suresh representing our group.
Okay, thank you, Govinda. So thanks for the discussions in our group. For the first question, the role of government evolved. We thought that local governments that were limited in technical knowledge and response planning and resources dependent on external support. So lack of resources was one thing, but then it also brought in the proactive nature of the government. So they started responding. An example of that is this communication channels, traditional communication, radio and TV. Initially, the uptake was not that high because of the connectivity challenges and so on. But the response of the government, particularly in terms of asking for a supplementary budget process and also the supply of equipments for the hospitals and additional doctors coming in, so that the response, the role of the local governments evolved in these aspects to respond to the pandemic better. To come to the second question of how could we strengthen the partnership, we thought the partnerships could reduce the duplication of efforts by the government, local government, as well as the development partners who are all going in different directions, could be improved by strong partnership with the local government, which again helps us to put a common platform where we can all come together and share information from the local level. And the partnership, one aspect of partnership is also data-driven decision making from the development partners working on the ground can actually feed the information to the local governments to make evidence-based decision making. That we saw as one of the partnership opportunities there. Coming to the third question on risks and opportunities, one of the major risks was probably the government, requested for special assistance, and that could be because of the emergency situation. Everybody wants to act and get on to solving problems. The risk was the duplication. Unless it is coordinated, there could be a risk of duplication. And of course, if the accountability mechanism is not there, there could be a problem of governance and corruption and so on in this environment of not coordinating the activities of various players. That's the kind of risk. But the opportunity was to build the capacity again, as mentioned by the previous group. One good example is the virtual learning, virtual platforms, working through virtual platforms like Zoom, and people get that culture of working virtually is an opportunity that came about. And also strengthening the capacity, local capacity of the local officials to work with the development partners was an opportunity. In the Titukulane case, we already saw that how COVID response was helpful in terms of reaching out to the local collaborators and then developing trust and working with them as an example of an opportunity as well. Thank you. Let's stop there.
Thanks, Suresh. That was good from your group. Let's move to the last group, group 3. We only had 3 breakouts.
Great, thank you. Yeah, so this is Natalie Hill. I was the group coordinator, but I was not convincing enough to find a volunteer, so I will report out for us. Yeah, no, we had a great discussion with some really good examples, and the other groups' thoughts are really interesting as well. I think on the first question on how the role has evolved, we reflected on, how things started out slowly and then, built on itself and accelerated with the amount of support and coordination. And so there was a real acceleration and how the work of the local government proceeded with all of the stakeholders coordinating and supporting it. In addition, we discussed, how levels of trust for local government changed over the course of the pandemic as it rode along over such a long period. And then that there were sort of challenges in some the example of challenges in levels of communication between government, that sort of response information collected by the national government wasn't always available to local government bodies effectively, which could impede how it worked. On the second question, there's some really good examples. I mean, one overarching point is that, a strong partnership needs to be proactively pursued and invested in all along, and not in figured out as a crisis unfolds, but invested in advance to ensure coordinated and strong partnership in a response. Some specific examples that were really strong is, in Malawi, the program included traditional healers in its response messaging and activities, which these traditional healers were influential messengers for communities and therefore strengthened the ability of government to reach its population. And so including those voices really strengthened the partnership and strengthened the response. And we've seen that also, the Nawiri example from Mercy Corps used sort of social media influencers to really find those voices that reach communities when maybe trust for government isn't that high. And then another issue is about really focusing in on quality of service delivery alongside. So, the idea of doing post-distribution monitoring as well as delivering, immediate needs and goods to make sure, and that improves services, builds trust, builds that relationship, and improves response. And on the third question, there's some really good examples that came up. On the risk side, I think a really important one that was raised by Tom is that, partnering with local governments can invest our resources and their resources along pre-existing lines of inequality, especially geographic inequality. If local governments have focused their resources in certain areas, in centers of administrative districts, that some populations may not receive the support that they need if you invest in the existing system and don't question how those lines of inequality might exist. And then some opportunities that were really strong are that taking the opportunity of this crisis, of this immediate need, to advocate to national levels of government to invest more in terms of resources and funding at the local level. So to strengthen the system in terms of resources and the ability of local government to respond in the future by advocating for improved financial and goods flows in the system based on the immediate need, I think was a really strong example. So I'll stop there. If there are any other voices from the group that want to chime in with an example that I left out, we would love to hear from you.
Right. Anyone from another group wants to chime in? If not, thanks. Those are great insights from all the 3 groups. We definitely appreciate the effort put into discussing those points. Let's move forward with the session. We are closing in on our collaborative session. First, I'd like to give a good, thanks to Ken Somanje, Tom Mtenje, and Edwin Mbaya, the three presenters from both Kenya and Malawi, for giving us great insights into your activities and the case studies on how your collaboration with the local governments have been evolving during this pandemic. We wish you guys all the best as you continue your partnerships with local government. Those are three very strong governance experts, by the way, within the continent. So thank you, the three gentlemen, for your presentations. I'll be handing over to my colleague, Govinda, who will wrap up with us this session and tell us what the next steps look like. Govinda, over to you.
Thanks, James. And thanks to all the presenters and the contributors in the breakout session. So thanks to all the three case study presenters. My internet connectivity is not stable, so I'm turning off my video. Yeah. So we are close to the end of this collaborative session on local government engagement during COVID-19. So all the presented three case studies and our breakout discussion, I think that responded quite strongly to why and how to engage with the local government and for what purpose. So these are the three key questions that I see, which we reflected on and responded. And I believe these are the crucial questions as we deliberate on the issues like engaging with local government to address the crisis or the pandemics like COVID-19 or the similar other pandemics. So it was pretty evident that finding the right entry points and having a strong mobilization and collaboration, and also finding avenues to sustain the outcomes are the key factors to consider, which were greatly highlighted in all the presentations and our group discussion. But as we see, these are the requirements, but we also do have the common challenges and opportunities, which we just discussed and reflected upon. The resource constraints, high expectations from the government, and potential of mismanagement of fund. Maybe it's because of the low institutional capacity, or maybe the intention, there are so many things that comes in, and duplication of efforts may happen. And then the weak coordination capacity of government. I'm not generalizing, but in often cases that happens, and the potential challenges in sustaining the outcomes. These are the some common challenges, and it may also increase the inequality in the development. That's also been raised by one of the breakout session. So these are the common challenges, but looking at that scenario, we have a lot of opportunities as well where we can engage in and make this collaboration effective for the benefit of the people. So these opportunities are synergy and response, which is avoiding duplication and supporting the capacity building, especially the building the culture. We talked about using the online platform. That was very challenging, but maybe if we intervene on the cultural aspect of it, maybe that we can address it, and inform policy based on the evidence, which was very strongly stood out in the conversation, and strengthening partnership relation with the government. Maybe it shouldn't be during the pandemic, but it can be preparatory action in the beginning or before the pandemic happens. So ownership of the local government and sustainability of approaches and interventions. I think these are some common opportunities that we see. But however, there are opportunities and challenges. However, if we involve local government in the planning process and motivate them to take lead on it and have a flexible implementation approach with hands-on evidence to advocate, I think we can strengthen our work with local governments to respond to the COVID-19 and also the future pandemics. So Finally, of course, we don't learn from the experience. We learn from reflecting on experience, what we are doing now. So this is not an end, rather a continuation of learning process, what we all doing. Let us all keep such deliberation moving and implementing approaches for the local government engagement to respond to the emerging context. As we move forward, we'll also look into the possible ways to connect and learn from each other more. And as an outcome, there will be the compiled document capturing challenges and practices from this case studies and the breakout discussion that will be produced from this session. And thank you so much for your contribution.
Thank you very much.
Okay, bye.
Bye. Thanks.
Bye-bye.
Thank you.
Thank you.